Oh, I can.
And we're live. Hello, it's Bill, the knee pain guru. Welcome to the Ask Dr. Beck show, brought to you by the Comella Foundation. Good morning, Charlie. How are you?
Good morning, everyone. I'm good.
Awesome. So, guess what?
What?
I twisted my ankle the other day.
Oh, seriously.
It wasn't bad. But when my ankle rolled, I totally felt everything you talked about last week.
Cool.
It was the coolest thing. I mean, well, you know,
right.
It was just fascinating to feel the bone shift and then push down on those other ones. And
have you got it fixed yet?
Yeah, we're good.
Okay, good.
Yeah, come on now. I implement stuff. I pay attention.
I'm glad. Just checking.
Okay, we have a couple of questions this week, which I'm pretty excited about. First one was from Sherry. We responded to her question last week.
Yep.
And she had said, and this has actually been coming up. I've heard this from a number of different people. Thank you so much for letting me know where to find Dr. Beck's response to my question. I wish he was closer. Does he have any recommendations for an osteopath in Nebraska or Texas? Anyone that practices the way he does? You two are doing great things together. Appreciate you taking the time to respond, Sherry. So that's been a theme. Like, how do we find somebody that's as good as you?
So good question, and there are honestly two answers to it. I'll say three answers. So the first one is the folks who practice manipulation, and percentage-wise, it could be 1% or 100%. They are listed on the American Academy of Osteopathy's website under Find a Physician. The folks who practice more cranial osteopathy, which is a more gentle approach, typically focused on the head and how the bones move, they're listed on the Cranial Academy's website. It's cranialacademy.org, and under Find a Physician. And then the last one is you can find PTs, massage therapists, and foreign-trained osteopaths that have similar qualifications close to what I have. Those are harder to find because they're not listed in one place. So you kind of have to ask around and pick up whatever the internet version of the yellow pages are and start looking for people who do manipulation.
Okay. So I have the Cranial Academy's website brought up. I want to make sure we get all these and put them in the notes for this video. So we got the Osteopathic Cranial Academy.
Yep.
Cranial
and then
Academy.
American Academy of Osteopathy. It's academyofosteopathy.org. My puppies are coming over for rubs this morning.
Nice. Academy of Academy of Osteopathy.org. The other ones you said you got to kind of ask and kind of figure out.
You'd have to almost do like an internet search on folks in your area who might do manipulation. I mean, you might find a chiropractor who's very, very skilled, might be a cranial sacral therapist, might be somebody that does orthobiotomy, could be a nurse who just happens to be very skilled at what they do.
Mm-hmm. Okay, I dropped the Academy of Osteopathy link in the live chat. I'm also grabbing the Cranial Academy Find a Physician link. In there as well. And that will go in the live chat there. Okay, and I'll get these in the description. The
Cool.
description of that, so that we'll address that. Okay. I'll tell you what, just my own personal frustration in the medical deal across the board is how very vast and different, you go to one doctor or you go to a doctor and you don't necessarily know what you're going to get.
Correct.
And so it's kind of terrifying nowadays from my perspective.
Concur. Yes.
Yeah. And we'll leave it at that.
Sound advice.
Okay, let's see. We have another question that came in on the Comella Foundation. This was body reflex hacking neck tension part 6. So this was one of the demonstrations of orthobionomy working with the neck. Okay. They write, oh, doesn't count. It was spam. It looked like it was well written.
Okay.
Talking something about Lamborghinis and things like that. Anyhow. Okay. I thought there was another question that was floating around somewhere. Give me a second here. While I'm looking for that, would you speak to this? Kind of ties in with the understanding that not all doctors are the same across the board. We're looking for distinctions and nuances. Would you speak to the understanding of a direct approach to addressing what's going on in the body and an indirect approach? I think that would be really valuable to make a contrast and educate people to understand the difference and why one would want to go with one as opposed to the other.
Sure. Okay. So in order to do that, we have to lay some background first, and that would be understanding what in osteopathy we call the barrier, which is the place that the body is supposed to be able to move, but it can't on its own. And so let's see if I can do this with the camera. If I take my arm and I bend my arm, and let's say it's stuck right here, so I can't straighten it, okay? Moving it and trying to straighten it would be going against the barrier. So I'm trying to do this. I'm going the place that it won't go easily on its own. And that would be called a direct application or a direct technique. Taking it away from the barrier, my arm will still go here, won't go there. So moving it this way, hey, you gotta be quiet. Moving it this way would be an indirect approach or going to the position of ease. Now, benefits of each. The direct approach is direct. It is usually fairly rapid. However, it can be painful. Most of my patients don't like being in pain. So when they come in and they're hurting, it's not my job to make them hurt worse before they get better. The indirect approach, you usually are following the body's wisdom. So the body will take you on a small journey, a dance, if you will, as it begins to unwind. And as it unwinds, it loosens the tension, brings you back to a working joint or tissue. It is gentler on the body. It is typically far less painful to not painful at all. And it is the method that I prefer for that reason.
Other than the body needing to be, or to possibly go into pain or to be more painful going into a direct technique, are there any negatives to it? Are there any contraindications?
So in contraindications, we have relative contraindications and absolute contraindications.
Okay.
Absolute is you don't do it no matter how good you are.
Okay.
Relative is every time you do it, you should really think about your skill level and can you do it safely. Okay. So an absolute contraindication for a direct technique would be a broken bone.
That's fair.
If it's broken and you don't know what you're doing and you're not trying to set the bone, don't go messing around with it.
Right.
Relative contraindications, I would say that this goes along with, again, your skill level and how often you apply the direct technique, but you can damage tissues in a subtle way, which over time can cause scarring and tightening of the tissues.
Okay. We've had conversations in the past where you were saying there are new patients that come to you that you work on and you need to work with or undo what has been done to them by previous doctors / practitioners, whoever they were working with.
Correct.
Could you speak to that a little bit?
If we go back to the discussion that we had about physics and how it works in the body, how any force that comes in from a physics perspective must be addressed by the body. Anything that it can't utilize, basically, it has to store from an energy standpoint.
Mm-hmm.
So if I'm treating you, Bill, we'll say that you're my patient at the moment, and I do something that your body likes, it really can take that in and it can use what I'm doing to implement change. From a physics perspective, there's no real stored energy there. We're actually releasing energy from a trauma. If we go backwards in time, we can undo what we just did to get you better, and we start with you still with your injury, and I do something your body does not like. From a physics perspective, now we have a conundrum, because now there was the energy of the original trauma, plus there's this thing that your body can't utilize very well. And it's got to do something with that energy that comes in. So that can make people worse. In its best scenario, what I just described would leave you neutral. But in a worst case scenario, it makes it worse. There's another layer that has to be removed before we can help the body to actually heal. Mm-hmm. And sometimes I put my hands on people and I feel that kind of thing in the body. Mm-hmm. And you have to work with that first before you can really get to what's underneath.
Got it. Are there any contraindications for doing an indirect technique?
Patient doesn't want an indirect technique. Still, that same fracture, you'd have to be really careful. Infections, it's interesting. The party line as a doctor when it comes to cancer is, if I see you on Monday and you don't have a diagnosis, I can do anything that I want to your body. And basically we treat what we find, and there's no contraindication from my part. If you get diagnosed on Tuesday and you come to see me Tuesday afternoon, suddenly I can't treat you because you have cancer, and the treatment that I gave you on Monday might spread the cancer. Now that's the party line. It also might make your body healthier. So if something like that were to come up, I always have a conversation with my patients and let them make the choice.
Sure.
Same with an infection, for example. If you had a skin infection, let's say you stepped on a rose thorn, and I treated your skin infection, there's that possibility it could spread somewhere else. Mm-hmm. There is also the possibility that treating the skin infection or treating the area around it might make it heal much faster. Mm-hmm. So again, it's a conversation that we have with our patients.
Got it. Okay. Well, I like it. It really starts to put your perspective puts much more nuance to the conversation in understanding what to bring to the body.
Yep.
And what I see in the the conventional approach, it is a very, black or white. Do
Yes.
it this way, and don't do it this way.
Correct.
And there's, when you start kind of pulling on that the string hanging out of the sweater, it starts to unravel.
Yes, the method that you just described takes away each person's uniqueness.
Mm-hmm.
It does make it easy if you, for example, are prescribing a pill, because if you check the boxes, you get this kind of pill. But what's interesting is, let's take knee pain, for example, and we randomly pull 100 people off the street with knee pain. Are they the same? I mean, in the fact that they all have knee pain, yes, they are the same.
Mm-hmm.
But the injuries that caused their knee pain are unique to every person.
Mm-hmm.
So therefore, if you treat them as they were all the same, you really aren't going into what happened to them.
Mm-hmm.
And so you can't help unwind what happened to them.
Mm-hmm. I had an example. This was a few weeks ago. I had a buddy reach out to me. He's like, I messed up my knee, and it'd been getting progressively worse. So he wanted to come in, and I worked on his knee a half hour, something like that. And he had minimal change in the knee until he said, well, then I was walking this way and my ankle kind of did this little twist. So I was like, okay, sit back down. And I worked on his heel, his ankle, his foot.
Yep.
And he stood up, and the knee pain was drastically different.
Oh, that's very cool.
In a couple of minutes. But it wasn't until that conversation that happened just shortly after he got up and was describing to me some dynamics that were going on that it even occurred to me to look at the ankle.
Yeah.
The foot. So anyhow, there you go.
Very cool.
Well, I guess the question that I was looking at was the spam thing. So we don't have anything else for today, which is all right.
Okay.
Anything else that's popping into your head you want to chat about briefly? Got any classes coming up? Anything happening on your end?
Got a class coming up in, I think, 2 weekends in West Virginia on cranial sutures. And then a class that's being put together in early November in the Houston, Texas area on the dental body connection.
Nice.
But you asked a question. So my brain works in the following manner. I see things that I don't understand. They percolate in my brain for potentially years. And then I have an aha moment. I'm like, oh, this must be the way that thing works. Mm-hmm. So background here, about 4 years ago, started working with a classmate of mine, and we started to work on what we called shock. Basically, the body goes into a pattern where almost all of the tissues in the body are affected, not just one. So it wouldn't be just like a knee that was restricted. This is the whole body that won't move in a direction.
Sure.
And we identified 4 different patterns that show up, at least in the patients that we have. So I've been treating those, not putting together the slightly bigger picture. And what seems to happen, this goes back to the foot. Mm-hmm. When we talk about the knee, for example, we think of the knee as a hinge joint.
Right.
So it works like a door hinge. Mm-hmm. Well, the reality is the knee can rotate left and right. It can side bend just a little bit. It can stretch apart and compact together. The tibia can move forward or backward, anterior, posterior. There's lots of motions that we don't think about when the knee happens.
Sure.
Because we don't really think about them, we don't test for them. Uh-huh. So the joint between the hind foot which is the talus and the heel bone, the calcaneus.
Yes.
That's basically your ankle backwards. That's called the hindfoot. From your ankle forwards for just a little bit is the midfoot. It's made up of 5 different bones. And then you've got the forefoot, which is the metatarsals. That's like the palm of your hand and the toes. Okay.
Right.
Where the hindfoot and the midfoot come together, named after the person who discovered it, is called Chopard's joint.
Mm-hmm.
And basically, I thought about it like a universal joint. It allows the foot to swing, plant the heel, the foot can swing left or right. It can bend just a little bit at Chopard's joint. But never thought about the fact that it might shear. It might literally the hind foot goes in one direction, up or down, and the midfoot goes in the opposite direction. Okay. So it would do this or that.
Right.
Never thought about that. So for the better part of a year, 2 years, whatever, I've been treating this shock by using the foot and vibration to vibrate that joint into freedom. Just never thought about it shearing. So this week, I'm like, I wonder. Started checking my patients. Sure enough, about 50% of them had things that I had never seen because we weren't taught to look for them.
Uh-huh.
And all of a sudden, when you do that, the ankle comes back to life when you treat it. So that's the new stuff for this week. It also seems to go along with the shock patterns. So when you get the ankle working right, the shock comes out of the body. And I'm still pondering the reasons why, but my supposition is it relates to primitive reflexes.
Okay, that makes sense. So here is something possibly similar,
Okay.
different direction that takes components of what you were just talking about, that and random conversations and videos that I've seen. So
okay.
The one piece that ties in directly is the vibration on the heel that I personally experienced when you treated me.
Yep.
To release shock in my system.
Yep.
Then there was a separate conversation I had with a very close friend of mine who experienced the PEMF machine for the Comella Foundation, and noticing how his body was dropping down or beginning to drop down. That added the conversation around having some sort of percussive massage or something before getting on the PEMF machine in order to drop the body down faster. Which then leads me to another conversation we had regarding the ability to adjust the frequency as opposed to just standard frequencies on the PEMF machine.
Correct.
Then that same friend sent me a video on, it's called the 11th harmonic. Are you familiar?
Haven't heard of it.
It's something that they were figuring out how to eradicate disease in the body. That there's something when a frequency, which is going to be different depending on the disease, but once they get 11 harmonics difference in the frequency, the specific frequency, it will shatter a disease, the whatever.
Interesting. Okay.
So now I have this 11th harmonics video that is talking about these. They went up and down the scale of frequencies. They hit 11th harmonics, it will shatter whatever disease is going on. Then I have you at this percussive massage thing on my heel, feeling it in my body till I hit that neutral and my body drops. I get a neurological drop. Then we have this PEMF machine that there's a guy locally here in Asheville that builds his own that would have the capacity to put a dial on a PEMF machine. So to have someone on a PEMF machine with the percussive massage on their foot, that to measure an 11th harmonic between the two, that's where my brain was going.
Yeah. Cool.
Anyhow, so I was taking these seemingly irrelevant or disparate concepts and weaving them together to go, hey, I'd run it by Charlie.
Yeah, that's cool.
So if there's any ideas you have in and around that, or I don't know if I sent you the video on the 11th harmonic.
I haven't seen it yet.
I'm going to send that to you. That'll probably be the next step piece.
Okay.
You check that out, how they described it. I'm probably not doing it justice, but then taking the percussive thing on the heel and then the PEMF machine that has the ability to be dialed up and down to hit that 11th harmonic in that, and let's see where that goes. And that could be tying in with the conversation we were having that one day on your porch earlier this summer.
So the problem is that when you get to an 11th harmonic, like if, let's just say we started low in the audio spectrum,
mm-hmm.
By the time you hit the 11th harmonic, you got some high frequencies. So from a tone generator standpoint, it might have to get into the megahertz or gigahertz in order to be able to get that 11th harmonic.
Okay. Yeah.
I'll think about it.
Yeah. The video and everything was pointing me in a different direction, going, huh, I wonder. Anyhow.
Yeah. It's, even if you started off with a low frequency subsonic of like 10 hertz, you're up there by the time you get to the 11th harmonic.
Mm-hmm. It's something. It's interesting.
Yeah, I'll look into it.
Cool. Awesome. Well, then we will see. Let's see. We're live here, so let's act like we have an audience. So if you like the video, give it a thumbs up, like and subscribe to the Comella Foundation channel, turn on notifications for future videos. Feel free to share this video with your friends, family, and loved ones. And if you have a question, you can go to, let's see, Ask Dr. Beck, the ComellaFoundation.org, Ask Dr. Beck. That's also going to be in the description box below of the video. Charlie, thank you so much for being here. Appreciate your time.
Thanks, my friend.
Have a wonderful day, and we will see you next week.
Sounds good.
Okay.
Thanks, everyone.